Welcome. Today we're diving into the intricacies of charcot-marie-tooth disease, often abbreviated as CMT. This inherited neurological disorder impacts the peripheral nerves, leading to a variety of challenges. Join us as we explore its causes, effects, diagnosis, and management. So, what causes CMT? The root lies in genetic mutations. These mutations disrupt the normal structure and function of the peripheral nerves. These nerves, crucial for transmitting signals between the brain and spinal cord to the muscles and sensory organs, are compromised. CMT isn't caused by infection or injury, but rather inherited faulty genes that affect the protein building blocks to a healthy nerve. Now, let's delve into the pathophysiology of CMT. The genetic defects typically affect either the myelin sheath, which insulates and protects the nerve fibers, or the nerve axon itself, responsible for transmitting electrical signals. Damage to the myelin sheath, known as demyelination, slows down nerve signal transmission. Axonal damage, on the other hand, reduces the strength of the signal. Both types of damage contribute to muscle weakness, sensory loss, and other characteristic symptoms of CMT. In terms of epidemiology, CMT is one of the most common inherited neurological disorders. It affects an estimated 1 in 500 people worldwide. Because it is genetically inherited, it can occur in any population, and males and females are equally affected. Many people may be unaware they have a mild form of the disease, and thus are undiagnosed. The signs and symptoms of CMT are progressive and vary in severity. Common early symptoms include foot deformities, such as high arches or hammer toes. As the disease progresses, individuals may experience muscle weakness in the feet and lower legs, leading to difficulty walking and frequent tripping. Sensory loss, often starting in the feet and hands, is another key symptom, resulting in decreased sensitivity to touch, pain, and temperature. Over time, muscle weakness can extend to the hands and forearms, impacting fine motor skills. Fatigue and sometimes scoliosis can also occur. Diagnosing CMT typically involves a comprehensive neurological examination, looking for characteristic signs like muscle weakness, sensory loss, and foot deformities. Nerve conduction studies are often performed to measure the speed of nerve signal transmission. Electromyography, or EMG, assesses the electrical activity of muscles. Genetic testing can confirm the diagnosis by identifying the specific gene mutation responsible for the disease. A family history of CMT can provide another indicator in the diagnosis. CMT is classified into several types based primarily on the affected gene and the part of the nerve that is damaged. CMT1 is the most common type and is associated with demyelination. CMT2 involves damage to the axon. Other less common types include CMTX, which is linked to the X chromosome, and dominant intermediate CMT, with both axonal and myelin involvement. Knowing the specific type of CMT can sometimes offer insights into the prognosis and potential management strategies. Currently, there is no cure for CMT. Treatment focuses on managing the symptoms and improving quality of life. Physical therapy is crucial to maintain muscle strength and flexibility. Occupational therapy helps individuals adapt to daily tasks and improve fine motor skills. Orthotics, such as ankle-foot orthoses or AFOs, can provide support and stability for the feet and ankles. Pain management strategies, including medication and alternative therapies, can help alleviate discomfort. In some cases, surgery may be necessary to correct foot deformities or address other complications. Given that CMT is a genetic disorder, there's no way to fully prevent its occurrence. However, genetic counseling can be valuable for individuals with a family history of CMT who are considering starting a family. Genetic testing can help determine the risk of passing the condition on to their children, allowing them to make informed decisions. The prognosis for individuals with CMT varies considerably. While CMT is a progressive disease, it is typically not life-threatening. Many people with CMT live long and productive lives, albeit with varying degrees of disability. Recent research is focused on developing gene therapies and other targeted treatments that could potentially slow or even reverse the progression of CMT. Clinical trials are ongoing, offering hope for improved outcomes in the future.